My name is Dr. Angela Chaudhuri, and I'm a public health specialist residing in Bangalore, having focused the better part of the last 2 decades on health system strengthening and health equity through Swasti, that is a health catalyst that focuses on making everyday well being a reality for the most vulnerable populations. It is a partner and a co founder of COVID Action Collaborative, also known as CAC, which is more than 350 partners, 80% of them who are grassroots organizations that came together because of the COVID pandemic in order to address the COVID pandemic response itself as a comprehensive response for vulnerable communities. So it's not just health, but also livelihoods, resilience, social entitlements, and all of those other areas that would protect the vulnerable communities. One of the aspects of the COVID Action Collab is something we call as impact canvases, where problem statements are ideated to form innovations. And one such innovation, and I will call it a jugaad innovation because it's really not, we're not the first ones who are doing it, is the environmental surveillance for COVID. This platform is called Precision Health Platform, and it's Asia's first open mixed source, so open drain and sewer system COVID surveillance, which is citywide, and the city is Bangalore. The premise behind the platform: when the clinical studies emerged that showed people who tested positive for SARS-CoV-2 shed virus in their stool, wastewater surveillance, as it is called, can be used at community levels to see potential for outbreak clusters before clinical diagnosis, especially in area where COVID-19 prevalence rates far exceed testing rates. The problem is that the virus is heavily diluted in the waste stream because of how people's bathrooms drain into it, and not to mention everything else that is get flushed. Surveillance really depends on concentrating the virus particles from wastewater to detect these very low levels of virus. This has a potential to represent a rapid and cost-effective method to support clinical surveillance and serves as an early warning system to identify and manage future of COVID-19 outbreaks. So when SARS-CoV-2 is shed in stool, we can assess the presence of it from the waste streams, and we can say how much of the disease actually exists. Vis-a-vis, as you know, more than 80% of COVID cases are asymptomatic, so they may never be ill, and so we may never know what is the potential for people to fall ill and how many of those ill people actually go to the hospital. Now, wastewater surveillance is not very new. It is being done in India to detect the polio virus. What we are doing here in Bangalore is essentially looking through 45 sites that represent two-thirds of the population in Bangalore. And from collection all the way to the dashboard, so we call it from drain to dashboard, there's a very strong digital architecture that connects them. There's a public dashboard. It's at bangalore.precisionhealth.in that gets updated every 2 days to show where are trends increasing, where are they decreasing, and where are they same. Therefore, regardless of whether people are testing or not, regardless of whether administrators are going ahead and testing, you will always have a real life experience of what COVID prevalence is about. Now, obviously, this is an interesting system to build health systems, but environmental systems should not actually just have COVID in it because then it doesn't become that useful. So we are looking at viruses and bacteria like typhoid, paratyphoid, cholera, antimicrobial resistance, all of which will help administrators in planning and response. The Precision Health program is a very easily replicable model as long as there's a strong digital backbone and we have the resources to collect the data or the samples, which is basically fecal samples from parts of the city where there is a confluence of excess of wastewater. It's very simple. We collect them, store them in cool temperatures. We take the temperature to see whether if it's too warm, the viral particles degrade. There are SOPs for all of the processes, which is collection, transportation, and then processing. Then the wastewater gets inactivated and processed in the lab where the RNA is isolated. And then there is regular RT-PCR that happens, and then the dashboard is uploaded. Now, the government intersects with this program in a few ways. Our Twitter handle, at Precision Health, just replace the O with a 0, reports every few days in a week, every alternate days, what the status is. This is followed by the city administration's own COVID update Twitter handle, which then retweets it, informs it, and that's how they're informed. If there are early waves, then we make special reports and have sense-making platform meetings with other epidemiologists and the technical advisory group of the government to see whether they're seeing similar trends, if there are other information that we might have, and look at what are the ways forward in order to respond to it. What we are doing in Bangalore is essentially jugaad innovation. What is jugaad? It's an Indian word to improvise quickly and cheaply, cobble a solution together from the materials we have at hand. So we took inspiration from KW Water Research Institute in Amsterdam and saw how we could do the same thing frugally. As I mentioned earlier, we have bike riders and ice boxes and local labs to do the work here. And essentially, we learned, we planned, we failed. We had very tight learning loops in order to be able to do this program and using off-the-shelf software to, since we are from the IT capital, to develop this program. Therefore, this makes it extremely replicable and adaptable all across India, and not just India, other lower middle income settings as well, because the cost of an entire city with 13 million population, and I'm speaking of Bangalore, is just about 2 crores to do city-wide environmental surveillance daily, and with 2 times every site being tested twice a week. And therefore, it is an extremely effective and efficient program to have in order to respond to not just a pandemic, but all the viruses which have pandemic potential. Information on the distribution of the virus within communities can help the governments assess the performance of interventions such as lockdowns, local response plans, and regarding community activities or implementing vaccine programs. Environmental surveillance has the potential to complement population surveillance methods, especially in countries and regions where there is limited capacity to test and trace. What we did was we quickly assessed our own and our partners' capacities and either increased the capacities or brought new partners in, advocated with the government to be a partner in this because without them, this is nothing, set up a strong digital backbone and communication protocols and policies. As you know that the data around COVID is fairly sensitive and political, have very tight learning loops and updated operating guidelines as we went along. And certainly, but not the least, enlisted eminent well-wishers to launch the program and continue to advise us as we move along. We are not alone in this initiative. We are following a handful of cities and countries that are now adopting it as a method to plan the COVID response better. Germany, Netherlands, Switzerland, many states in the United States, university campuses, etc. So I believe that we do need to scale it rapidly and cheaply and spread the world around. Thank you.